Cholera in Syria is fast spreading. Thousands are being treated for the highly contagious disease that transmits through contaminated water and food. The outbreak was declared in September. Since then, more than 70 people have died. Thousands more are being treated.
This is Hassan, my son. He is sick and has severe vomiting and diarrhea. I brought him to the centre. My son's blood pressure had dropped considerably and he was very tired. But after a day or two, his condition has improved a lot, thank God.
Access to health services and clean water is hard in a country devastated by years of war. International and local NGOs are doing their best to respond to the crisis, but they complain of the lack of medications, vaccines, as well as water treatment materials. The situation is not any different in neighbouring Lebanon, where the disease was detected a month after the outbreak in Syria.
There is the issue of cholera vaccine. We are asking the international community to help bring the vaccine to Lebanon. Unfortunately, there is a shortage because there are many outbreaks across the world.
Until then, there are efforts to contain the outbreak. Water in Lebanon was already unsafe to drink without treatment, but the nearly bankrupt state doesn't have enough fuel to run water stations.
We are very scared. We are old and frail, and the problem is that we can't even afford to buy bottled water.
The World Health Organization says sewage water testing indicates cholera has spread to regions far from the initial cases. The vulnerable are already at risk. In Lebanon, that means Syrian refugees living in camps where the ground is fertile for the spread of the disease.
Once I saw my child drinking water from the well. It is dirty water. Sewage goes in there.
So far, officials here are downplaying the general contamination of water networks that supply millions of people. But experts say the risk is there. Zeina, Khodr, Jazeera, Beirut.